Hi, my name is Gina Libby, and I am an advocate, action network leader with the American Pain Foundation, and we are an awesome organization that serves to raise awareness about the undertreatment of pain in America, which is a huge problem. And I serve in this position because I am a person who has experienced a lot of pain in my life. I don't really like to, I'm going to try and be really honest here, and I really don't like to go into the story about it because I feel like living with untreated pain for a long time changes your internal system. It absolutely does. And for me, as I think back of my story, if I think back of the years that I didn't get care, or the years that I suffered with a disability and just was angry and irritated and didn't really know what was going on. I've come a long way since then. By getting treatment. I've used a lot of different therapies and such, but I realize now that when I tell my story, when I talk about things in the past even, I feel pain. And so this is a kind of a precarious situation to be in, because I know this about myself, and yet I want to serve, and I want to help people, and I want to be able to share my story. But when I relive that story or think about that story, which is basically years living with pain with no help, and I've got scoliosis and I had corrective surgery when I was 20 years old, so I have 2 rods in my back and a long spinal fusion, scar from neck to tailbone. I mean, I'm an obvious case of someone who would be experiencing pain, and for many years when I went to the doctor, I just was ignored. And I know that so many more people are ignored because they have conditions that are invisible. And mine was about as obvious as it gets, and I was ignored. So what I'm trying to share here is that the changes that occur when a person lives with pain are just full of loss. And there's definite physiological effects. And I'm really aware of those, which is why I try and reduce my stress level a great deal and keep my attitude positive and work on cognitive behavioral therapies and such, because as I experience things that are upsetting or stress and stuff, it plays out in my body as physical pain. So where does this leave me? This leaves me to share with you that